Plus, federal government once against research for publication's sake as experts unveil Compedium for health reforms. The Minister of State for Health and Social Welfare, Dr. Isako Salako, wants Nigerians' health research to move beyond academic exercises to more practical tools for solving real-life challenges facing the country. Salako gave the charge at the unveiling of a knowledge products compendium by the Salina Center for International Development and Research, SCIDaR, describing it as a valuable contribution that departs from research for publication's sake by highlighting tested interventions that improve lives. The minister assured that the Bola Ahmed Tinubu administration was determined to overhaul the health sector through evidence-driven reforms. The executive director of the National Primary Healthcare Development Agency, Dr. Miwa Ainor, said the compendium was timely as Nigeria embarks on new primary health reforms.
These are things that are coming out of field experience, things that are practical, things that have been implemented, and the results being turned out. So, for example, the way you deliver vaccines or immunization, they have practicalized it, and they can see that if you do it in this manner, the uptake for immunization is going to be higher. So these are things that can be domesticated.
There are things around how you reduce postpartum hemorrhage using heat-stable carbetocin, for example, that I saw in the compendium. That's a major issue that we're contending with as part of our effort to crash maternal mortality. There are other insights around how you manage vaccines in the field to minimize the risks of temperature excursions. Those are things that are lessons that are very useful for us.
How are we then socializing what we have beyond the lunch? How are we having those conversations, going from office to office, sitting with the different government agencies, saying which component is relevant to you in an immunization program, on a maternal health program, on a HIV program, which component is relevant to the state government. How do we sit with them, with those managers, to say, now we've done the launch, now we've circulated it. How can we track that is actually translating into action?
Stakeholders at the event agreed that the test will be in implementation and ensuring that the compendium moves beyond its unveiling to shape decisions in hospitals, clinics, and policy tables nationwide.